Cardiovascular disease is the leading cause of mortality in developed and developing countries. High LDL cholesterol and triglyceride concentrations along with low HDL cholesterol concentrations are associated with elevated cardiovascular disease risk. To ensure that you maintain heart health, it's important that you consume cholesterol-lowering foods and avoid high cholesterol foods that lead to inflammation and weight gain. When it comes to lowering high cholesterol naturally, strictly avoiding all high cholesterol foods is not necessary. In fact, foods that contain cholesterol can still be consumed regularly. It's all about moderation and balance. The following foods should be avoided to decrease LDL and increase HDL cholesterol levels. Number 1. Canola oil and other processed vegetable oils. When canola oil undergoes hydrogenation, which it often does to become a partially hydrogenated oil, this increases its level of trans fats. These are a group of fats that you want to avoid as much as possible since they're scientifically known to increase LDL cholesterol and lower HDL cholesterol levels. Number 2. Potato chips and other packed foods. Extensive research evaluates the rise in snacking, snack foods, and ultra-processed foods in the American diet. Some studies show that 66% of calories consumed by U.S. citizens comes from packaged foods and beverages. Because snacking and snack foods have grown in frequency and number, eating frequency has also increased, leading to higher rates of obesity and high cholesterol levels. Number 3. Cookies and other sugary treats. Dietary sugars serve as the cause of obesity, several chronic diseases and a range of cardiometabolic risk factors. Today in the U.S., over 75% of packaged and processed foods contain some form of added sugar. Research shows that added sugars have been associated with increased LDL cholesterol, raised triglycerides, and decreased HDL cholesterol. Number 4. Bacon and other processed meats. Recent studies have shown that processed meats are associated with increased cardiovascular disease and stroke mortality. Evidence suggests that processed meat consumption increases the risk of heart health issues, while unprocessed meat consumption has a small or no association with cardiovascular disease. Number 5. Alcohol. Too much alcohol raises your blood pressure and triglyceride levels, while moderate alcohol consumption, up to 5 grams per day, may decrease the risk of cardiovascular disease. Research shows that higher levels of consumption increase the risk of developing heart issues, beginning at 30 grams per day for women and 45 grams per day for men. Number 6. Milk and other conventional dairy products. Milk fat contains a broad range of fatty acids, and some have a negative impact on cholesterol-rich lipoproteins. The saturated fatty acids, such as lauric acid and myristic acid, increase total plasma cholesterol, especially LDL. Research shows that replacement of dairy-saturated fatty acids and trans fatty acids with polyunsaturated fats decreases LDL cholesterol levels and is associated with a reduced risk of cardiovascular disease. Number 7. Refined grain products. A diet high in refined carbohydrates, like white bread, tortillas, bagels, and pasta, has a negative effect on your HDL cholesterol level. Studies show that refined grains have a high glycemic index, and consumption of these kind of carbohydrates lead to significantly higher risks of high cholesterol. Reducing your intake of these types of carbohydrates can improve your HDL levels. Opt for high-quality, sprouted breads and fruits instead. Sprout